Dr. Sautai. I am a child and adolescent psychiatry fellow in the US. Today we will be discussing about ADHD, or Attention Deficit Hyperactivity Disorder. It is one of the most commonly diagnosed mental health conditions in the children. So I have developed this lecture series where we will learn about the understanding of the ADHD brain along with the risk factor, causes and treatment options. I will create a different topic for each section in my upcoming videos. This video is just an introduction video for the series. So let's dive further into ADHD. This is a general medical disclaimer. Please pause and read. So, what is ADHD? A very commonly asked questions, what does it mean? As the name indicates, it's an attention deficit, so something with the attention, and hyperactivity disorder, which we will learn further into what does hyperactivity means. This disorder affects how we pay attention, sit still, and control our behavior. Now this is more commonly seen in children, but it can grow into adulthood. This is a more medical terminology where we say chronic means long-term neurologically based illness characterized by persistent pattern of inattention or hyperactivity and impulsivity. So basically, ADHD is divided into inattentive type, predominantly hyperactive or impulsive type, or combined type, which I will discuss further in this lecture. Now, what is normal and what's abnormal, that's something we need to understand. So it depends on the child's developmental age, right? So we compare the patient's symptom with someone of the same age and we'll see that how much the symptoms are impacting or impairing the child's function. For example, a child is a children, right? For example, a patient is a children, then does it affect his academic performance? If it's more of a grown-up, then does it also impair his work performance, right? So we make the ADHD diagnosis based on the symptom from two different settings. The behavior has been present for at least 6 months. Now, as a parent whose children has symptoms of ADHD, the teachers will complain a lot because the symptoms are impairing the child's performance in the school. The child may be very disruptive. So the common complaints that the teacher makes are he's always disrupting the class, never sits still, like jumping around, does not sit on his chair, he blurts out his answers even before the question is asked or before the question is completed. He does not wait for his turn, does not follow instruction, needs constant redirection, very talkative, that's how he disrupts the class, and he needs constant redirection as we discussed. And there are other symptoms which I will go further in the later part of the series. ADHD behaviors or symptoms will also be seen at home. So some of the common symptoms or observation made by the parents or a relative or guardians is that he has so much energy that he's always on a go, like there's a boat or motor attached to him. And my kid is like this since very early on, right? Like since he's born. Like I have heard that too. He does not seem to listen to me. Like, when I ask him to do his chores and he goes to his room and he forgets and started doing something else. Like I just told him a minute ago to throw the trash and now he's just in his room and doing something else. I don't know whether he's doing it intentionally or whether he forgets about it. He appeared very distracted or lost in his own world and so on. So now if you have seen, there's some common things. The symptoms appear more like behavioral disorder, right? So, and this is very common with the ADHD, that the symptoms needs to be differentiated from other medical conditions like oppositional defiant disorder, conduct disorder, maybe child have intellectual disability, have some other learning disorder, or may have both, like so maybe have ADHD along with anxiety, ADHD along with some other comorbid conditions. So this series is not to make a diagnosis, it is to, for as a parent, to learn about the symptoms and then to seek help from the psychiatrist or psychologist, a medical health professional. Some facts about ADHD. Now, this is from CDC, a 2016 national data, a national parent survey showed that 6.1 million, 9.4% children were ever diagnosed with ADHD. The same study shown that it is more common in boys, 12.9% compared to the girls, 5.6%. ADHD may be missed in girls because of the symptoms or the presentation. The symptoms of ADHD in girls are more inattentive type, and in boys are more hyperactive or impulsive type. So the criteria. The psychiatrists make diagnosis of ADHD based on DSM-5 criteria. The earlier criteria was to diagnose the condition before 6 years of age. However, the latest DSM-5 saying the impairment should be before age 12. It should be present in at least 2 settings. So for younger children or adolescent, home and school or college. For adult, because the symptoms can also grow into an adulthood, where we can say that from home, school, college, or also at work. It is not possible that symptoms are present in only one setting and completely disappear in other setting. Then we might need to rule out some other medical conditions. This ensures that the behavior occurs globally, that it does not just restricted to school or home, because if it's just restricted to one setting, it could be something else. That there are different categories or different types of ADHD. So we call it ADHD predominantly inattentive type. Now what does it mean? What are the symptoms of inattentive type? So 6 or more of the following symptoms that may present of at least 6 months. The child is easily distracted. For example, a teacher is giving a lecture and someone passed by the door. The child starts looking at the door and completely lost what's going in the class. So it's very easily distracted. Or some other children is making noise. The child looks at other children and then just lost in there, forgetting that he is in the class or what's going in the class. So it's easily distracted. Does not follow direction or finish task because he is not paying attention. And now I'm saying if the child is ADHD, it's how their brain works, right? They have some impairment of paying attention. So they're not doing it intentionally. It's how their brain is working. So they're not able to finish their task on time, which of course affect their academic performance. They might getting lower grades, failing the class, does not seem to be listening, does not pay attention, make careless mistakes, like make spelling mistakes, does not read, does not do the proper calculation. Now, we need to also rule out the learning disabilities, right? Some children have dyslexia, so they have hard time reading. So again, ADHD symptoms are carefully explored. He forgets about daily activities, has problem organizing tasks. Now again, it depends on the development, right? The age of the child. If it's 5 years old and then it's 12 years old, there's some different organizing abilities, right? Between the two. So we need to compare a 12-year-old child with another 12-year-old child who does not have ADHD. And then the same expectation. We cannot make expectation from a 5-year-old child to be as organized as a 12-year-old child is. Does not like to do things that require sitting still. Or I would say sometimes it requires a lot of attention. Often lose things like losing pencil in the class, losing books, a water bottle or lunch box, or if little older children losing their mobile phones or their glasses, tends to daydream. Again, I would say it's like lost in thoughts. I don't know what he is thinking. For older children, sometimes the people around them are make a complaint that, are you even listening to me? It doesn't seem like you're even listening to me. So those kinds of complaints or symptoms a patient present with. The next is hyperactive or impulsive type, which is more commonly seen in boys. It does not mean that it is not present in girls. I'm just saying it's more commonly seen in boys. So they often squirm, fidget, or bounce when sitting. So they does not sit still in their chair, right? Running, jumping, if depends on home or school, right? Just cannot sit still. They have trouble playing quietly. It's always moving, such as running or climbing on things. I don't know what's going on with my child. Older child, he's restless, you know. I don't know. I ask him to sit still. He cannot even sit still for 5 minutes. My God. So those are the common complaints made by the parents or teachers. He talks excessively. Just keep on talking, right? Always on a go as if driven by a motor. Again, has trouble waiting for their turn. So teachers the commonly the teacher asks everyone to raise their hand and wait for their turn, and the child just bluntly answer it even before the question is completed, right? So it's which disrupt the class, and teachers don't like it. Blurt out, I already said it, interrupts other people, interrupts in their games, butt into other people's conversation. So there are a lot of these are the common symptoms, right? And the presentation can vary from individuals. Now, in some children, they have symptoms for both inattentive category and hyperactive. So we call it ADHD combined type. The causes of ADHD. So there is no one particular cause of ADHD that we can pinpoint. The research is ongoing and which has shown that the genetics plays a biggest role. That ADHD in biological parent or biological siblings, those child are more risk of developing ADHD compared to general population. If their brains are exposed to some harmful chemicals, the development of ADHD brain is a little different, and that's a very academic discussion that I cannot go in this lecture series. Have been exposed to poor nutrition, being neglected, infection, smoking, drinking, and substance abuse during pregnancy, like parents who are using marijuana, cocaine, other harmful drugs or medications while pregnant. And I'm not saying all medication cause it. So that can affect the brain development of a ADHD child. Toxins such as lead can also affect the brain development, brain injury or brain disorder. Now, not all brain injury can lead to ADHD. So, but if the frontal lobe is damaged severely, because this frontal lobe involves with executive functioning, attention, behavior, then the child or even adult can develop ADHD symptoms. Now, there are different treatment modalities of ADHD, which we basically decide based on the age, risk factors, other comorbidities, clinical presentations, other risk factors. So it's a multimodal approach. Many symptoms of ADHD can be managed with medication and therapy. So I usually, a child who are a little younger, like less than 5 years old, I usually prefer therapy to do some behavior modifications. Parent can take some parenting classes, how to manage the ADHD child before starting medication. But it also depends on the severity of the condition, because in some cases we need to start medication even in younger children if needed. Medication type are like stimulant medications, which are the most commonly medication given in ADHD. And you might have heard Adderall, Concerta, Ritalin, Focalin. There are different kind of ADHD stimulant medication, broadly divided into methylphenidate group, which is a different chemical, and amphetamine group, which is a different chemical. They affect our neurotransmitter in our brain to help child being more focused, less impulsive. And non-stimulant medication like clonidine, guanfacine, which are also given in some cases where stimulant medications are not working, or for example a child has severe heart issues, disease, and pediatric cardiologists have not cleared for stimulant medications. In other cases, like older children, adolescents who are using drugs, or there's a substance abuse in the family. In those cases, we might prefer non-stimulant over stimulant medication. Therapy. Now, start with the special education. In the US, the public schools, for sure, have programs where they assess the children who have some academic difficulties, and they rule out a variety of medical or psychiatric conditions, including ADHD, dyslexia, learning disabilities, and those are provided for free. And based on that, the diagnosis, they make some behavior modifications. They give them some extra attention. They may give them one-on-one attention. So they make some changes in the class that suit best for the child. And this is a right of your child. So let's say if you are suspecting ADHD, make sure you speak to the school teacher, counselor, so that your child get all those services. The school might offer 504B plan, or they might offer IEP plan, which is called Individualized Education Plan, based on your child's condition, risk factors, what is his diagnosis. So they make some behavior modifications. And then psychotherapy. There are very good psychotherapies. In most cases, I usually do both, like give them medication and then also refer them for psychotherapy so that the child gets best help. And developing skills that can help the child in the future. The information is taken from UpToDate website, which is a very commonly used medical website used by the healthcare professionals. There's a very nice article by Dr. Joseph Osterman from Cleveland Clinic about ADHD and behavioral disorder assessment, management, and update from DSM-5. I really appreciate your time. I tried my best to provide education to general population in some simple words so that we are aware if our children has those symptoms, and we seek help as early as possible so that our child does not struggle academically and get good grades, which as a parent is a very common expectation from the children. I will continue making further lectures on ADHD, and we will go further into different treatment options, what as a parent what we can do for our ADHD child, as a teachers, what kind of therapy, what kind of modification we can apply for those ADHD children. So please like, subscribe my channel, leave a comment, give your valuable suggestions. I'm open to, this is the first series on my YouTube channel, so I'm open for any kind of feedback and suggestions. Thank you very much for your time. I hope you like it.